Hi, I'm Dr. Gregg Carb, and this video is the science of sitting made simple, posture and ergonomics for the home and office, which is based on 35 years experience working on patients with postural strain and ergonomic-related injuries. This will be condensed material from the Science of Sitting Made Simple book. The key to retaining this information is to first understand why and then understand how. We'll present this information in 4 steps: body basics, the normal spine; body movement, connective tissue; body breakdown, wear and tear; and body balance, do it right. So let's start with body basics, the normal spine. We're going to look at the spine separately from the back view and the side view, but remember, it's all the same one structure. So from the back view, the head should be centered over the pelvis and the spine should be vertically straight and is composed of the neck area or cervical spine, the rib cage area or thoracic spine, the lower back area or lumbar spine, and the sacrum and pelvis at the base of the spine. From the side view, the head should still be centered over the pelvis, with a forward arch in the neck, backward arch in the ribcage area, and forward arch in the lower back. This forward arch in the lower back, the lumbar lordosis, is the foundation for proper sitting, which we'll get to in a few minutes. For now, let's talk about body movement, connective tissue. When you side bend, flex forward, and extend backward, your spine changes shape to accommodate that movement. The spinal bones or vertebrae are hard tissue and don't change shape for movement. It is the connective soft tissues between the vertebrae, changing shape by lengthening or shortening, that allows your spine to move into different positions. These connective tissues are kind of shrink-wrapped onto the spinal column and both hold it together and allow it to move, as shown here on a drawing connecting these 3 vertebrae, and here on an actual specimen. So the important point here is, when you repeatedly get into and maintain the same posture and position, the connective tissues of your spine gradually change to that position. And that becomes the default shape of your spine. This is not normal aging. It is deformity from postural strain over time. Next, we'll look at body breakdown, wear and tear. If you recall, this is the normal side view of the neck area. And this is the normal forward arch, or cervical lordosis. We will look at an X-ray of this part of the neck from this side view. The base of the head is directly over the shoulders, and the arch of the neck is evenly spaced and symmetrical. Now we'll look at a healthy specimen of the same area. This is the side view again of the neck or cervical spine. These are 3 vertebral bones. These are 2 intervertebral discs. This is the spinal cord, and these are the cervical spine articular joints. After years of poor posture, the normal forward arch of your neck can be straightened out or bent backwards. Let's take a look at an X-ray of this area. And we can see that the cervical spine here is bent backwards. In this unhealthy specimen of the same area, we will zoom in to see some detail. This disc is completely eroded and the vertebral bones are projecting outward. And the spinal cord here is getting compressed. These kinds of posture habits will fast-track you into a deformed spinal shape and advanced wear and tear. Turning our attention to the lower back, you can see the normal lumbar disc is wedge-shaped when maintaining the normal forward arch, or lumbar lordosis. If you round out your lower back, the lumbar discs are compressed as your body weight shifts forward. And eventually, the compressed discs will look and feel more like the top sponge compared to the bottom sponge. In terms of muscle effort, if your center body weight, which is distance A, shifts forward over your spine, as in slouching, the distance A increases and the muscle effort is much greater. So you have much better strength and stability with healthy alignment compared to poor posture. Which is why, for example, divers, gymnasts, and ice skaters most often have excellent form. So now that you know why, let's look at how to have better posture and ergonomics with body balance. Do it right. We'll consider both sitting and standing. First, sitting. Foremost, the biggest difference here has to do with this area. To review, the side view of a healthy spine has the head aligned over the pelvis and the normal spinal arches maintained. In particular, it is essential that the lower back arch, or lumbar lordosis, be fully supported at all times when seated. This is best done with a lumbar support that fits snug into the forward arch of your lower back, but does not push your hips or shoulder blades away from the seat back. Now we'll get to some basic guidelines for setting up your workstation. Maintain the normal anatomical distance between your hands and your head. If working on a laptop, use an external monitor or keyboard to separate the screen from your mousing and typing surface. Sit well back into your seat back, which should be upright and locked in place with lumbar support. Make sure your feet can be flat on the floor or, if needed, on a footstool. Your elbows should be at a 90-degree bend, and, with your shoulders relaxed, your hands should meet your keyboard and mouse. The upper part of the screen should be at eye level and about an arm's reach away. Sitting forward of your seat back and leaning your body into your computer screen will only result in strain and pain of your neck and back. Also keep your shoulder muscles relaxed as if your arm were just hanging down. Just bending your elbows should not increase shoulder muscle tension if your mouse hand is down and in instead of up and out. Otherwise, your neck-shoulder muscles will be very unhappy. Now let's consider standing. Wear comfortable shoes and consider standing on a special mat to cushion your weight. Keep a neutral upright alignment of your spine and the same 90-degree bend of your elbow as with sitting. Lastly, don't just stand there. Always move. Shift your weight back and forth or side to side constantly. The benefit of sitting is you can be fully supported. The downside is sitting is sedentary, whereas the benefit of standing is movement, and the downside is no support and increased foot and leg strain. So get the best of both by sitting supported up to 60 minutes at a time, followed by standing and moving for at least 10 minutes or more. Now for a brief review. The spine has a normal, healthy shape to maximize both strength and flexibility. You can bend your spine out of shape over time by repeating the same poor posture positions, resulting in pain, stiffness, and permanent wear and tear changes. So always maintain a neutral spine position with good posture. At the end of the day, you'll be glad you did.